High mortality rates. The country's infection tally is now 20,88,611 and 14,27,005 patients of coronavirus disease have been cured across the country. 48,900 between Friday and Saturday morning, taking the recovery rate to 68.32%. This is the second day in a row that India has reported a daily rise of more than 60,000 COVID-19 cases. There were 62,538 on Friday morning. The gap between active cases, 6,19,088 so far, and recoveries has further widened to more than 8 lakh. Data also showed the death toll stands at 42,518 according to the Health Ministry's dashboard. Test, track, treat, effective implement by the centre in the state and union territories has ensured that India has one of the lowest COVID-19 cases and death per million population compared to several other countries, the government said on Friday. It is also said that India has continued testing more than 6 lakh samples for the third consecutive day in a row. India's resolve to rapidly increase the number of tests done per day has resulted in a successful march toward 10 lakh per day testing capacity with 6,64,949 tests conducted in the last 24 hours, a government release said. The cumulative testing as on date has reached 2,21,49,351 and the tests per million have also been seen a sharp rise to 16,050. The Health Ministry has asked 16 districts in 4 states reporting higher COVID-19 mortality to adhere to measures suggested by central advisories and guidelines. These includes Ahmedabad and Surat in Gujarat, Belgavi, Bengaluru urban, Kalburgi and Udupi in Karnataka, Chennai, Kanchipuram, Ranipet, Theni, Thiruvallur, Tiruchirappalli, Tuticorin and Virudnagar in Tamil Nadu, and Hyderabad and Medchal Malkajgiri in Telangana. Apart from the higher cases mortality, these districts account for 17% of India's active case, high daily new cases, low test per million and high confirmation percentage. The districts were advised to ensure that the advisories, guidelines and clinical treatment protocols issued by the Union Health Ministry are adopted and effectively implemented to reduce the mortality among COVID-19 patients and other preventable deaths among all the section of the people, particularly those with comorbidities, pregnant women, the elderly and the children. The states were advised to ensure optimum capacity utilization of testing lab, increase test per million population and reduce confirmation percentage, in addition to ensuring timely availability of ambulance with target zero refusal, the ministry said in a release. Bureau Report. India reported 3,28,903 new coronavirus cases in the first 6 days of August. The corresponding figure in the US was 3,26,111 and in Brazil 2,51,264 according to the worldometer.info. India's daily cases have been the highest in the world on 4 of the 6 days of this month, 2nd, 3rd, 5th and 6th August. India's case load crossed the 20 lakh mark on Thursday, with the fastest rise in cases from 1 million to 2 million among the 3 countries that have reached the grim milestone so far. India's infection growth rate of 3.1% was also higher than the US and Brazil at the 20 lakh stage. In death, however, Brazil and the US have both registered more than 6,000 fatalities so far in August, while India's count is 5,075. On Friday, Maharashtra and Andhra Pradesh continued to register above 10,000 fresh infections. At least 5 states reported their highest single-day spike in cases. Bihar, 3,646 new cases, Telangana, 2,207, Orissa, 1,833, Punjab, 1,063 and Manipur, 249. For the third day in a row, Maharashtra added over 10,000 cases and reported over 300 COVID-19 deaths on Friday. Andhra Pradesh on Friday reported the highest single-day toll of 89 deaths and 10,171 fresh COVID-19 cases, also becoming the third state in the country to soar past the 2 lakh case load. The cumulative tally of the state stood at 2,06,960 cases behind Maharashtra and Tamil Nadu, the two states having clocked the 2 lakh coronavirus cases mark long ago. The state's death toll also jumped to 1,842. Meanwhile, the number of fresh COVID-19 cases in Chennai fell below 1,000 for the first time in 52 days on Friday, while Tamil Nadu recorded its highest toll with 119 deaths. Chennai had 984 of the 5,880 fresh cases in the state, which pushed up the case tally to 2,85,024. The cumulative death toll was 4,690. Active cases stood at 52,759. Bureau Report.
ओहो सरकार शूट कर रहे हैं ना, भेज देंगे और कल या फिर ये होगी। ओहो सरकार शूट कर रहे हैं ना, भेज देंगे और कल या फिर ये होगी। ओहो सरकार शूट कर रहे हैं ना, भेज देंगे और कल या फिर ये होगी।
An expert panel to oversee all aspects of its COVID-19 vaccine plan is likely to be led by Niti Aayog's Dr. V.K. Paul and co-chaired by Health Secretary Rajesh Bhushan. It will pick the vaccine or vaccines that India can use, plan the finances for what is sure to be an expensive purchase running into billions of dollars, and prioritize the sequence of administration. In the absence of a vaccine or a cure, the only way to slow the spread of COVID-19 has been wearing masks, social distancing, and restricting regular activities, things that have taken a toll on life and work. The high-level panel formed by the Cabinet Secretary on Friday includes AIIMS Director Dr. Randeep Guleria, representatives of the Ministries of External Affairs, Biotechnology, Information Technology, the Director General of Health Services, India's AIDS Research Institute, the Indian Council of Medical Research, and also representatives from the states. The panel's task starts with identifying the vaccine or vaccines. Countries such as the US and the UK are spreading their risk, striking deals with multiple vaccine makers who are ahead in the race to develop a vaccine. It will then decide how the vaccine should be procured, whether foreign agencies should be involved, or whether the state governments will be allowed to procure on their own, or there should be a central procuring system directly under the supervision of the central government. The group will also draft a financial plan, prepare a budget, and discuss how money can be raised for the mammoth exercise of procurement, distribution, and administration. Finally, the panel will prepare a strategy on inventory management, distribution, and administration. Many of these issues have been discussed over the past month across ministries and institutions. The authorities are carefully watching the development of at least 9 vaccines, including at least 2 Chinese ones, and hoping that the Oxford AstraZeneca vaccine being made in India by the Adar Poonawalla-led Serum Institute of India works. That, though, is a second-generation problem. India first need to identify a vaccine and procure enough doses of it. Bureau Report.